Welcome back to part 5 of Just One Thing. We have arrived at the last segment of our 5-day series, and today we're going to be talking about sitting. We're all going to sit sooner or later, and you might as well learn how to sit well. One of the things to keep in mind with sitting is, as much as possible, work to decrease the amount of time that you spend sitting. Our bodies are great at adapting, and if we spend the majority of our day in this position of 90 degrees of hip flexion and 90 degrees of knee flexion, our muscles, particularly our calf muscles and our hamstring muscles, are going to adapt to being in that shortened position. So number 1, decrease the quantity of your sitting. And number 2, which we're going to look at today, is how can you sit in a way, specifically looking at the alignment of your sitting, so that you are able to sit in a way that minimizes the damage that sitting causes to your body. Let's take a look first at some of the anatomy so you get a brief overview. We're looking here at the front of the pelvis, and you have the left and right halves of the pelvis that curve around towards the front and meet to form the pubic symphysis. If we turn the pelvis around so you can see it from the back, then here we are with the left and right ilia meeting on either side of this triangular bone called your sacrum. Where these two sides meet up with the sacrum is called your sacroiliac joints. So we have a left and right sacroiliac joints here. These joints continue to be mobile. There is no interlocking of the sacrum with the ilia, but rather they butt up against each other and are stabilized with ligaments and muscles, but there is still mobility present here. Then at the very tip of the sacrum, you can see this little bone here called your coccyx, and this is a tailbone. This is what, if you slipped and fell on the ice, you may have broken your tailbone. The other thing I want to point out to you, if we look at the underside of the pelvis, you can see this nice bony frame that supports your pelvic floor muscles, which run front to back, and side to side. And these muscles, the length of these muscles, are largely influenced by the position of the bones. Because the sacrum and the coccyx are able to move, they can be at a nice optimal position, an optimal space between the pubic symphysis and the back of the pelvis, or, and our sitting can influence this, they can move closer to each other, which means that the muscles that attach to these two areas are going to be put in a shortened position. We don't want that. We want to maintain optimal length of our pelvic floor muscles so that they can generate just the right amount of force to support all our pelvic organs. When we sit, we're going to be looking at how can you sit being supported by your ischial tuberosities, these areas on the base of your pelvis. If you're sitting on your ischial tuberosities, then you are not weight-bearing on your sacrum and coccyx. If you have a tendency to tuck your pelvis when you sit, then you are at a higher risk, or there's greater likelihood that you are weight-bearing on your coccyx and or on your sacrum. When we weight bear on those bones hour after hour, day after day, week after week, year after year, then we are changing the position of the bones, we're bringing these attachment points closer to each other, and we're changing the length of our pelvic floor muscles, which is not what you want to be doing. So let's look at how not to do that in your sitting habits. All right, so if you are in a chair as you're watching this, I want you to just take a minute and tune into your body and notice, how are you sitting? Are you supported by the back of your chair? Are you sitting up? Just take a minute to notice. And then I want you to kind of rock side to side so that you can feel the bones on the base of your pelvis, your ischial tuberosities, and feel what it's like to have them support you and to be weight-bearing primarily on those bones. And then just notice, take a minute and tuck your pelvis under so that you're rounding your low back and you're sitting back. And notice how that shifts the weight more towards the back of your pelvis and more likely onto your coccyx and your sacrum. And then shift back forward. So you're kind of rocking back, and then you're rocking forward. And you're rocking back, and you're rocking forward. And then settle into your forward position, because this is really where you want to be spending your time when you are in a seated position. You want to be supported by your ischial tuberosities. You may notice that you need to put a pillow or a cushion or roll up a towel if you still feel like you need a little bit of the support from the back. Most chair backs are angled back, so they don't help you in your quest to be supported by your ischial tuberosities. So you'll need to probably make some adjustments to your chair. And then the other thing to keep in mind is you don't have to always sit on a chair. There are times when you'd look a little strange if you didn't. But when given the option, if you can, choose the floor over the chair, because this changes the joint configuration that you're putting your body in, and it gives a greater variety of positions, which means your muscles are being asked to be at different lengths, your joints are being asked to be in different positions, and this variety is what our body thrives on, and it helps to prevent adaptation occurring in a negative way. So give yourself lots of variety, choose the floor over a chair whenever possible, and when you are sitting, make sure that you're sitting up on your ischial tuberosities and not weight bearing on your sacrum and your coccyx. Again, thank you so much for being a part of this series. I hope you continue to implement and explore what you've learned over these 5 videos, and especially today, practice how you sit and notice how you sit, and whenever possible, catch yourself and shift back so that you're weight bearing on your ischial tuberosities. I look forward to seeing you in the next video.